Trigger point therapy. Your health and well-being is important to all of us. Today, your healthcare provider has requested that you watch this brief video. If you have tight knots or tender points in your muscles, especially in your back, legs, and lower torso, it is likely you're suffering from trigger points or muscular adhesions. Over the next few minutes, we'll explain what trigger points are, how they develop, and what you can do to resolve them. Your muscles are made up of many layers of tissue fibers that glide on top of each other, which allows smooth, controlled movements of the body. A trigger point is an area within a muscle where the fibers have become disorganized or tangled and are unable to glide on top of each other. An example of a trigger point that you have probably seen is the gristly area within a cut of meat. The gristle is an area in the muscle of the animal where the fibers became disorganized and did not function properly. Muscular adhesions are areas where scar tissue has joined two areas of the body together that are not supposed to be joined. Imagine thick like cobwebs gluing muscles to joints or other muscles sticking to other muscle fibers. This greatly reduces range of motion and movement. This combination of trigger points and muscular adhesions results in decreased function, decreased stamina, increased pain, and increased risk of flare-ups and slower healing time. Pain from trigger points is not only at the point in the muscle where fibers are disorganized, but can also be referred to other areas of the body. The most common areas for trigger points to occur are muscles that maintain body posture, such as those in the neck, upper back, shoulder, and pelvis. When pressed, a trigger point feels like a knot or tight band in the muscle that is very tender. Healthy muscles usually do not contain knots or tight bands and are not tender to normal touch and pressure. Relaxed, healthy muscles feel soft and pliable to the touch, not hard or dense, even after a workout. Trigger points often start with some stress to the muscle, such as an injury, poor posture, or improper body mechanics, repetitive use, or a nerve root irritation from spinal misalignment. Often the first symptoms of a trigger point are pain or constant dull aches at multiple locations and uncomfortable sensations. If a trigger point is left to develop long enough, the pain may decrease, but those who suffer continue to experience muscle weakness and decreased range of motion. Once trigger points are relieved, range of motion is usually restored. Trigger points can easily return to being active and cause pain through overuse, overstretching, chilling, or other perpetuating factors, prompting the patient to believe they are experiencing a new problem, when in fact it is an old problem re-aggravated. Trigger points are very common, and because they do not always cause pain, people are not always aware that they have trigger points. In fact, research has shown that 92% of people have one or more trigger points that are causing muscle dysfunction. This study also indicates that some people are more prone to develop problems with muscular pain than others. People who exercise regularly are less likely to develop trigger points than those who exercise occasionally and overdo their exercises. A common way most people have experienced a trigger point is by sitting in front of a computer holding a mouse. After a while, this causes tightening and stiffness of the shoulder girdle. If not stretched and loosened regularly, trigger points and fibrous adhesions can form. It feels like a tightened area, an area with knots, or an area with decreased movement and function. Other activities and postures that you may have noticed causing that same stiffness and knotting feeling include sitting in a chair without armrests or armrests that are too high, sitting in a chair with poor low back support, holding a telephone receiver between the ear and shoulder to free arms, carrying a purse or day pack that is too heavy or carried over one shoulder, and any activities that require you to bend over for extended periods, such as dentists, hygienists, architects, draftsmen, and secretaries or computer users. Other factors that contribute to formation of trigger points and adhesions include lack of exercise or sedentary lifestyle, scar tissue from trauma or injury, nutritional deficiencies or improper diet, fatigue or lack of sleep, joint problems or poor biomechanics, and misalignments or subluxations. Your doctor or a soft tissue therapist will usually be the person performing a trigger point therapy. Using the hands, the patient's skin is gently pressed to locate underlying tight bands or nodules of muscle fibers. Then using the hand, fingers, elbow, or small hand instrument, the targeted muscle is compressed with sustained pressure to relax it. As pressure is applied, some patients experience temporary discomfort until the muscle relaxes. Others may feel referred pain in other parts of the body. An example of this involves the gluteal muscles, which travel from your pelvis to the top of your leg. Trigger points in these muscles can mimic the symptoms of sciatica, a radiating pain from the buttock down the back of your leg. Another example is the pain caused by piriformis muscle trigger points. It is a harsher, more electric pain than from gluteus minimus trigger points and is felt in the back of the thigh, the calf, and the sole of the foot. There may also be other abnormal sensations, such as numbness, tingling, burning, or hypersensitivity in any of these areas. Approximately half of the time, trigger points are not located where you feel symptoms, and working on those areas does not provide relief from the symptoms. Receiving trigger point therapy is a highly effective way to reduce muscle spasms and relax hyperactive muscles. It also helps restore normal range of motion and promotes faster healing. The patient benefits of trigger point therapy include: it reduces chronic muscle spasms, it helps prevent scar tissue formation, it improves muscle tone, it promotes better circulation, it increases range of motion, and it overall decreases pain. Today we have looked at what a trigger point is, what causes them, how treatment is performed, and factors that increase your likelihood of developing trigger points. Trigger point therapy is an additional therapy that your doctor or therapist will likely combine with other treatments, such as spinal adjustments, therapeutic exercises, or other forms of physiotherapy. Regardless of the treatment provided, it is important to follow your doctor's instructions for proper long-term healing and to prevent a relapse of your condition. Your healthcare team has a star player, you. With you leading the way towards a better state of health, it's important to keep all appointments, follow your treatment plan for longer-lasting results, exercise as instructed, eat properly, and follow stretching and ergonomic recommendations. Working together as a team, you and your healthcare professionals can decrease the likelihood of future problems and prevent degeneration from advancing, decrease relapses or flare-ups, and stop the development of chronic pain syndromes. A better quality of life is the wellness goal to better health. With the help of trigger point therapy, you're on the right path to achieving that goal. If you have additional questions about the information presented, please ask your healthcare provider for assistance.